Hi, this is your Houston chiropractor, Dr. Gregory Johnson. We have Amaris here with us today, and Amaris has been treated in here before. She's a weightlifter and stays in shape, as you can see. And we're going to adjust her entire spine. And we want to continue to bring up this issue for the citizens of the state of Texas to be able to have their freedom of choice of their healthcare provider, whether that be a chiropractor or a medical doctor, because the Texas Medical Association is trying to take away our scope of practice to diagnose and treat nerve conditions, which is what chiropractic's all about. We treat neuromusculoskeletal conditions. They're trying to monopolize healthcare in the state of Texas, and they've sued the Texas Board of Chiropractic Examiners and won in Austin. So we are raising money now to fight this appeal, and we'll fight it all the way through, against the Texas Medical Association to preserve our rights that we currently have to diagnose, treat, and rehabilitate vertebral subluxations and neuromusculoskeletal conditions from you coming in directly off the street. And you came in right off the street from a referral from your boyfriend, right?
I did.
Yeah. Okay, so we're going to show you how we're going to treat Amaris here today. Okay, let's flex your head forward and backwards for me. Neutral. Okay, she's got just a little bit of forward head posture and a little bit of rotation to the left. I bet she's sleeping on her side and her stomach a little bit more. Pelvis is off just a little to the right, but not too bad. Okay. So the very first thing I'm going to do on Amaris today is we're going to lay her down here on her back, and I'm going to decompress her spine. So let's go ahead and lay right here for me. And Robert's loving this. There we go. There. You near tight enough? You're not going to get away?
Not at all.
Okay. Now, a lot of you ask how this manual spinal traction / decompression / ring dinger feels. I'm going to let Amaris answer that for you. Here we go. Let me put this under your chin there. Okay, keep your teeth together. Take a deep breath in. Let all your air out. Oh, yeah. Home run. That was a lot better than the first one, though, wasn't it?
That was better than the first.
So, while you're on the table, tell our YouTube fans how that felt.
It feels,
Truthfully.
well, at first it's kind of scary, like, you know, because you just feel like literally crack from like here all the way up to your neck. And it sounds like very like crunchy, but
Very loud inside.
Yeah, it's like very like relieving afterwards.
Okay, good.
I feel better after.
Yeah, see there? Everybody's better after the ring dinger. And there is the Palmer diversified rotary brake, left and right, which are even, by the way. For all you cavitation addicts out there, we changed from calling people crack addicts to cavitation addicts, because some people got offended with the crack addicts.
They're gonna love the sound of that.
That's right. Yep. Crack addicts are gonna love you. Here, let's set you up here. There we go. And we mean that funny, you know, all you trolls out here who take us too seriously or don't take us seriously. By the way, cavitation is movement of any joint past the paraphysiological space to the anatomical integrity of the ligament that releases a nitrous gas bubble inside the synovial joint. That's what the noise is. It's not your bones cracking. That tightens up a little bit right there in your low back. Not bad though. Your legs are pretty even today. Left one's a little short. Is that a little tender right there?
It wasn't normally.
So we're going to adjust her left SI joint first. And then her sacrum right in the center. Sacrum on the right. And then her right SI joint. And now I'm going to get on L5 and I'm going to drop that straight P to A, posterior to anterior from the Z axis. That was L4. There's L3. L2. we're working our way up into the thoracics. Okay, just breathe normal and exhale. There you go. Okay. I still got one right here. There it is. I knew it was in there. Did you feel that? Mm-hmm. Yep. See, your legs are exactly even now. You shouldn't have any pain at all in your lower back here. Does that hurt? Mm-mm. Okay. Yes, ma'am. Okay, let's turn you on your back now. Good. That girl. Bringing your head up and back over your shoulders where it's supposed to be. Get your head on straight. You've been hearing that from your mom your whole life, huh? Let's slide down this way a little bit. Now I can do it. No, that's too far. Yep, just a little bit. There, a little bit more. Now put your arms out to the sides. Okay, we're adjusting her acromioclavicular joints now, her sternoclavicular joints on the left and the right, and now her costovertebral, or costosternal joints, on the left and the right. This is not a boob adjustment. This is a rib adjustment. I'm going to adjust her knees, her hips, and her low back from this end. You feel that all the way up?
I did.
That girl, good job. Okay, let's hit you face towards Joseph. There we go. Get all your little pinkies there. Good. There we go. Okay, so you come over here and stand in front of the mirror for me again. Okay, I'm going to have you close your eyes again and bend your head forward and backwards, please. And then back to neutral. Now, just take a look. She's right down the center right now. Her head's still turned a little bit to the left, but you can see her cervical spine's right in the center. Her arms are at the sides of her thoracic, or her pelvis, and her hips here right where they're supposed to be. But her homework is this. Pull your shoulders up and back. Flare these hands way back here like this. Now I'm going to bring your head straight back because you were twisted a little bit to the left. I'm going to do exactly the opposite of that. Do a little tap there and there. Okay, now relax and flex your head forward and backwards again. Yep, that should have felt smoother, like it was on a swivel. Good. So what would you have to say to the citizens of Texas about your freedom of choice of healthcare providers?
Well, I mean, I would much rather choose my own caretaker and stuff like that. I don't,
You'd like the choice to be able to come here rather than having to be referred here by a medical doctor. Yeah, because most of them wouldn't refer you here anyway.
I don't think so.
We get a lot of referrals from medical doctors, but those are the more progressive ones. This is all about money. Whenever when you guys are coming to see us, we're not prescribing medications or performing surgeries. Those are big dollars. So I'm going to be leaving a direct link on the description box of this video on how you can donate to the Texas Chiropractic Association CDI Fund. It's a Chiropractic Development Initiative, and that will help us to fight the Texas Medical Association in this lawsuit to appeal it so that we have the right to direct access. You have the right to come see us directly as opposed to being controlled in a monopoly-like state in the state of Texas for medical doctors to control everything. So if you want to be medicated to death and operated on all the time, go ahead and do nothing. If you want to support our profession and protect your right to come here first, or even after you've seen a medical doctor, then donate to our cause and help us to win this lawsuit. Thank Thank you very much. This is your Houston chiropractor, Dr. Gregory Johnson, coming to you from Advanced Chiropractic Relief in Houston, Texas. And we'll see y'all soon.